Okay, not to waste our time, he's on the call and he's in transit, so we'll simply start, and then anytime you join us, we can continue with his comments. So the presentation is actually Telecom Innovations for Public Health Practice. It's a 6-month project, pilot project, approved by the Leadership of Association of Public Health Physicians. It's called the ViGit system, and we're piloting this among public health physicians and their inner cycles. This project 2480. So it's going to be piloted for 6 months, starting May. So we have May up to November, and then we will now write a report about the finding of this. So the exercise essentially is to share knowledge and then get members to be aware and voluntarily take decisions in favor of the project we're implementing. The presenters today are myself, Dr. Tefa Kene, public health physician, and then Joshua Tahole, who is the CEO of ViGit Platform International. Luckily, he is available to be part of this call. Last week, he was busy as well. So I will be taking the first part of the presentation, and I'm the project manager for this. I take responsibility for whatever happens. Now, what do we know about telecom industry? According to NCC reports, the network data of 2020, in spite of recession brought by COVID, telecom industry has continued to grow. Now, one thing that happened during COVID was that every other sector went down. In fact, because of lockdown, people were not moving, but this was an industry where at that time, people were making more calls, people were using Zoom. In fact, most of us didn't know about Zoom until COVID. So that consumed a lot of data, which means our users of this data can be part of the growth that the industry have noticed. Now, evidence have shown that growth has consistently been noticed within the industry. This represents, as of today, 12.6% growth increase in revenue. Of course, if you read papers, you would have seen that MTN has shown a 1.7 trillion revenue as at December last year, similar to other telecom industry, telecom companies. So the question we're asking is, for us, what we see all the time is that telecom takes away, so many things take away money from us as doctors. The bank takes us a lot of charges for everything we do. The insurance company takes money. Zoom takes a lot of resources. Social media takes a lot of resources, both money and time. And of course, the telecom industry takes away money and time. Now, the question is there any way that this money that is taken away from us can come back and circulate within the health sector? It is for this reason that we had this big question that keep agitating our minds. That is there any innovative financing mechanism? How can this telecom digital cash flow that we're seeing on a daily basis circulate among public health practitioners to enhance the quality of work? Luckily, yesterday, or within the week, the government of Nigeria approved the health insurance, National Health Insurance Act. And in that act, there's approval that at least 1 kobo should be taken as tax from calls. Now, at least means that it can be 1 naira, it can be 50 kobo, it can be 20 kobo. But imagine 20 kobo, 30 kobo, 40 kobo, 1 naira, entering any account for the purpose of health. That is possible because everything is digitalized. The challenge is that when that money accumulates, the process of the usage of that money becomes cumbersome. And of course, you know the stories around those lines. So we've been thinking about this for 18 months. So is the government thinking about options that telecom can bring resources within the public health sector? So it's for this reason that Ave Health Sense, in partnership with ViGit Platform International, has come up with systems that will circulate value and create a source of income while taking care of your expenses, whether personal expenses or office expenses. Now, what does this system mean? There are 3 components of this system. We call it the ViGit system. The first component is the digital tool for real-time data capturing, for key performance indicators, and feed-based monitoring. Now, you agree with me that with increasing technology and increasing challenges of security, it's becoming difficult for us to physically reach facilities where we provide services. But technology gives us opportunity to where we can develop digital tools, and individuals who live in those locations can actually send data to us. So that's one component of the ViGit system. The second component of ViGit system is the virtual top-up automated telecom trading system that offers 1% weekly commission for call cost recovery. I just spoke about the tax, the telecom tax of at least 1 kobo per call, which means there must be a call before the funds are deducted. Here too, we are saying that the system trades weekly. And once it's a trading activity, the system deducts 1% of the trading funds, and it goes to the public health physician, it goes to the system created to support public health practice. Now, the third company is Advanced Combo Pack Basic, which is a mini audio telehealth system. These connect individuals in different locations. So, for instance, if we connect all the primary care facilities in a particular state, it means that individuals can communicate 24/7 and then receive supportive supervision, receive monitoring support, and any other form of support from this with a dashboard that is available. These are the three components of the ViGit system that we worked on. So to provide details as to what the telecom back end on this system look like, Joshua is available in the house and he will do that. So Joshua, over to you.
Right, I'm sure everybody can see me. Very good evening, everybody.
Good evening, sir.
Okay, Mr. Dr. Obaji, very good evening. Once again, my name is Joshua Tahula, as introduced. I want to first start with this statistics I got last week. The first top 10 Nigerian companies that have the highest revenue. So last week I got it. First on the list is MTN. Unfortunately, I was not able to include it in the presentation so that you can see it. MTN is starting as the first one with 470.9 billion. That is from January to April, as it covering the period for the first quarter of 2022. So followed by Dangote with 480 billion, down to FM, that's flour mill, with 302 billion, down to the list is the same Dangote again, that's Dangote Sugar with 94 point something billion. So with this, assuming you are getting the public practitioners are getting just 0.1% of 470.9 billion. In the first 3 quarters, I'm sure we would have been talking of hundreds of millions by now. And that is where this partnership comes between ViGit Platform and Ave Health Sense. Ave Health Sense, in partnership with ViGit Platform International, are saying that the public health practitioners to take advantage of this huge transaction and revenue that goes on in the telecom sector unnoticed. You buy your airtime, you use your data, you pay cable TV, you're on Zoom burning data just like we are now, you're on international calls, and all the times you are doing research on internet. In all these things, you are burning airtime or data, or you are spending money. The money that you are generating from somewhere is being burned on telecom tools, but you yourself, you're not getting anything, and this thing is here for you. So in partnership, we present My Wallet Shop, that with this My Wallet Shop platform, you can eat your cake and have it. How? The 470 billion we're talking about, if assuming it is the public health practitioners that generate this 470 billion or 70.9 billion for MTN alone, the 1% we are giving back for them patronizing or having shop on My Wallet Shop would have run into billions, hundreds of millions that they would have used that and be taking care of their bills in the office, like paying of salaries, running the NEPA, the generator, and research and other things. And that's where My Wallet Shop comes. My Wallet Shop is saying that the public health practitioners, instead of buying your airtime from the bank and other places, please, you can go ahead and be purchasing airtime, be recharging, be buying data from my wallet shop. You'll be getting 2% in this automated VTU platform, 2% whenever you buy airtime or buy data or even pay cable TV. And again, if you decide to own a shop on my wallet shop to take care of your day-to-day expenses in your office or your yearly expenses or your monthly expenses, this shop is generating 1% weekly for you on the shop that you have. The categories of shop for people that are inside the system, the categories of shop depend on your capacity. So it's just for you to know how much you spend in a year. Assuming you spend about 500,000 in a year, and you have a shop that the system is automatically selling this airtime for you in a year and is generating that 500 and something thousand for you, your capital is back for you. It simply means at the end of the year, you run your office at a zero expense. What you would have used originally to run an office has generated another income from this telecom that we're talking, mentioning billions, and is taking care of your expenses. And what do you get? You get 2% on every airtime if you recharge by yourself, 30 naira if you pay cable TV, and 1% if you join the automated VTU system, whereby the system is selling this airtime to the public on your behalf. So every 7 days, you get your 1% and it's withdrawable to take care of your day-to-day expenses, your monthly expenses. And then you have the other bonuses like the 10% if you decide to bring other things. Let's move on. The next slide. And then we are saying that because you involved in research and you are spending so much on calls, you can equally reduce your expense on call by adapting the Combo Basic Pack. The Combo Basic Pack is one of the services from one of our major telecom partners, which is 9Mobile. It enables you to talk to the group of people for free. The normal CUG, you know, but this one is an advanced CUG because when you recharge your line with 1,000 naira, your airtime is there for you. But for the group of people that you're communicating with them, you are talking for free. So on calls, you are no more burning airtime. And also the expense that you would have run on other places, my wallet shop is also running and bringing this money for you. So in two ways, if you're running a research, you run a research on free calls while you have your airtime there. And if you decide to generate income for your expense, you have a shop that is running that. And the costs here are cheap. So combining these two tools of my wallet shop and with the Combo Basic, you run their office at a very 0%. And then finally, we integrate this with Flutterwave. We told you this is an automated, next slide. We told you that this is an automated system. So all these things that we're talking about on my wallet shop for the public health practitioners to take advantage of, everything is automated using the digital tools. So you don't necessarily need to be doing manual work for these things to be working for you. During the time of question and answer, we can expand more when question and answer come up. Thank you so much as Dr. Kenneth continues with the presentation.
Dr. Kene, you're muted. Kene, you're muted.
It's true. Thank you very much. Can you hear me now?
Yes.
Yes,
Okay.
loud and clear.
Good. So I was saying that I'm going to take the implementation plan, and I've started by saying that there are issues with public health practice that we're experiencing. One, the fact that we have increased costs on a daily basis with the same salary. There's little hazard allowance. The inadequate funds for interventions, no matter how much documents are written for sustainability plan. Once the project ends and the funds are not there, boom, everything ends at least if anybody tries 6 months, the project ends. Of course, we cannot run away from monitor evaluation. So we need digital tools that can help us with that. Supportive supervision is what we need to do, but we are experiencing a lot of security challenges every blessed day. There's no state down that you can travel to that you are very sure you will not be afraid. So we need to digitalize systems on account of this. Of course, we spend a lot of money on Zoom. In fact, most telecom companies now are making a lot of money from data model costs. And of course, nobody's giving us communication allowance in practice. So this project came out of the last presentation in Ilori, where the communique was issued by a public health physician that the federal and state minister of health, as well as their divisions and related agencies, should adopt the digitalization of public health interventions to improve efficiency. Now we felt that as Ave Health Sense, we should start this process and pilot it so that individuals can feel confident to provide support in their various states as far as the digitalization process is concerned. So what is this project assumption? Now the project assumption is that increasing the circulation of telecom funds among public health practitioners will improve and enhance the quality of their work. And of course, the simple equation is technical know-how plus skills, technical know-how and skills minus finance equals to frustration. So if we now add finance to this, there will be excitement. And as we've been on this for 18 months, just within a week, the National Health Bill was passed, and they were talking about at least one kobo per call. What it means is that calls that we are making are now going to circulate money within the health industry. You can imagine how much will come into it. And of course, we are trying to do this for public health at this moment. So the project strategic plan is to have 4 weeks Zoom meeting for training. This is the 3rd week. We've been on this every week since May, the beginning of May, Wednesdays and Sunday. This is the 3rd week. Next week we'll have another special guest. We also need to activate my wallet shop for at least 5 members per state so that they can test run this and have how the system works, and then give us feedback so that this feedback will be shared with the public at our conference. We're going to conduct digital tool design training for interested states. This training can be virtual or can be physical as the state shows interest. Then deploy mini audio telehealth for selected institutions, and deploy the complete ViGit system in selected states. So what is the life cycle of the project? For 4 weeks in May, we are going to make these Zoom calls Wednesdays and Sunday. Next week will be the last week of the month, and then would have done Wednesday and Sunday next week and ended that part of the project. My wallet shop activation for 5 members per state. So from May to July, we'll be holding individual meetings with people, calling members to let them know, and calling state branches, and of course scheduling Zoom meetings for states that want us to do that, so that we get at least 5 members per state to activate their account. And then of course we'll conduct digital tool training from May to October. I just said that we're going to do that virtually or physically, either sponsored or whatever arrangement that the state want to have with us. We'll now look at deployment of mini audio telehealth from May to October. Of course, ViGit system deployment will continue, will be on a continuous basis. So by end of October, in November, we'll now do the project evaluation, and then take December to write the project report and present at the APHPL conference in River State in January. So this is the project life cycle. Now, the application of my wallet shop in project management. These are the basic needs that you have in every project. Power supply bills, communication bills, fuel, office maintenance, pay Zoom. These are necessary expenditures. Now, at the end of 12 months, this money, whether you like it or not, will never return back to you or to your system. It goes elsewhere. So the question we are saying is that, is it possible that we can return this money? And that is where my wallet shop that Joshua just spoke about coming. We are saying, calculate, estimate your expenditure per month. Put everything together, get a shop that can offer you 1% commission per week to service those expenditures. So for instance, if I'm spending 50,000 per month on Zoom, airtime, NEPA, and others, it means that in 12 months, you would have spent 50,000, so that's 600,000. That money can never return back to you. Now, if you now acquire a shop, if we let this money acquire a shop, the shop will trade, offer you the funds you need to service this project. At the end of the 12 months, the project needs are met. At the end of 12 months, the trading fund remain intact. Then you would have practically operated on zero overhead cost. As some of our members are here, they will share their experiences at the end of the presentation. Those who have actually been testing this project with us for more than 12 months. So this is what it means. When sustainability is viewed as being a matter of survival for your business, I believe you can create massive change. Now, each time I have opportunity, I talk about this, that technology does not reverse itself. If government can now start thinking about 1 kobo per call, it means that it's government that will allow telecom to run, because it's known that telecom will be a source of income for the health sector. So there's no way they will stop telecom from running and going back to those days when we need to go out, when we want to buy, want to have a line, you go to Nitel and spend the whole 3 months looking for them to connect line for you. That can never happen as far as technology is concerned. So what is a ViGit solution? It's a real-time data monitoring tool that will capture data and, of course, do away completely with paper-based forms and all its issues. It gives you a solution at state level that moves paper away from completely out of the system. And of course, as we're implementing, we can do a transition so that we have backup. The system now is so effective that it gives you monitoring and supporting supervision opportunity. So how does it work? The first option is developing of soft copy tools for monitoring and evaluation for key performance indicators and feed-based monitoring. So whether the tools are existing, if their tools are existing, fine. If their national tools, perfect. If they are known, we'll develop questionnaire, checklist, whatever. Once we have that available, we'll design and deploy real-time data management system for you for monitoring. Then we'll create dashboard. We have virtual dashboards and physical dashboards in offices where supervisors and leaders can get this done. Then the common pack basic that comes with it gives opportunity for 24/7 supportive supervision because the individuals within the system are connected. The design of this closed user system is such that it is self-financed because it's automated centrally and it's financed centrally. Now, Joshua told you that, okay, if you're going to set up a CUG, you need 1,000 naira every month. So if, for instance, you have 100 people who are connected to a closed user group, it means that you have to be spending 100,000 per month. Now, with this system, we simply get my wallet shop to trade and give us commission of 100,000. That commission of 100,000 is automatically used centrally to actually power the CUG. So whether project has ended or not, the CUG will keep running, and that will connect the team. We have free 12-month supportive supervision, technical support for this assignment. Our team provide that. What is the benefit of ViGit system? It gives you access to clear, accurate data, unlimited connectivity, it's easy flow of operations through automations. There's low cost of operation, and of course, it gives you opportunity for versatile work. Now, this is seamlessly done. Now, what will be agitating your mind is what are the risks associated with this system that we've been working on for over 18 months. Now, if there's a change in government policy on the use of virtual top-up, remember some years back, we used to have young men who were on the street selling recharge card. Now, they are no longer there because the virtual top-up system have taken that industry. Government cannot go back to that stage because, of course, I said technology does not reverse itself. Another option is the fact that there could be alteration of telecom value chain incentives for virtual top-up. Yes, it's possible. During the Zoom, the COVID period, the telecom made a lot of money from data, so they were giving a lot of incentives that also impacted on this. Now, if there's change in the cash flow that comes in, they may reduce the incentive. Now, if there's a telecom change in policy on the use of closed user group, some are focusing on data now, so they're not more investing in cost. So that could also be something that can happen. Of course, limited network coverage by telecom industry will also be a limitation. If you take maybe a particular network to a location, it may not be working there perfectly because of network coverage. So we need to, at the point of deployment, we usually do an assessment to understand that environment. The another issue that can affect the work we do is the rising cost of Android phones and dashboard accessories. Of course, you know what is happening to a dollar and naira, and that affects the cost of some of these accessories. So These are the project risks and limitations. So where are we going to get resources for all this? The first thing is philanthropic support for digitalization. So we could get people who are willing to help digitalize a particular project in the state. For instance, my friend Gidado is here, he's in Geneva. He can actually tell anybody that, look, digitalize my state for me, and the resources will be available and will do that. We can also have resources from budget allocation from the state. We have international donors that want to support. These are areas we should be looking at. Then, of course, donation of device from manufacturers or distributors. Then the health insurance scheme model in various states can also put money to get this done. So what is the action plan for all public health physicians in Nigeria? The first thing is to subscribe 5 public health physicians per state, who will be the early adapters. Then the second thing is that primary health care boards to use this audio telehealth and monitoring system as a pilot so that they can see and give us feedback on what their experience is. Then they should be scaled up on the model through cycle of influence. I see people talking to their close ones and other things to have an idea, and that is good so that we can have these systems tested. Now, some people are already part of this and they will share their experience. Telecom will actually never reverse itself, and we must position ourselves to take position. So this picture just gives a graphic explanation of what the cycle of influence means. So these first five people who come in are public health physicians working with us can actually subscribe, and then through the model of respondent driven sampling, they can actually scale it up within the cycle of influence and within public health association members. Now, we know the theory of division or innovation. So we are innovators as far as this is concerned. We are looking for the 13.5% early adapters. So we want you to be part of this process so that you can critique the process, you can learn what it is, and of course, the opportunity that comes with it will come to you first. And then, of course, as we do that, we'll see ourselves contributing our value to our association. Now, so this is the project code 102480. The link will be shared in the chat box. For those who want to actually sign up now, they can go sign up. And of course, I want everyone will give feedback on the state of things. We have from Plateau State, 2 people have activated, 1 have signed up. Edo State, 1 person, Rivers 2, Kaduna 1, Bayelsa 1 person have signed up. Adamawa State is in discussion with us on the use of ViGit. Yobe is also in discussion. I'm having preliminary discussions with Benue State. I'm looking forward to discussions with Taraba. The special guest last week had a call with me and also mentioned the fact that they're having a small project. They want to see how they can pilot additional activities in Taraba. So in conclusion, once social enterprise have a diverse and stable set of income streams, they are better placed to have a greater social impact. The truth of the matter is that public health physicians need to have streams that can come and solve some of these problems without them getting involved. Once that happens, most of our work will be long-term, most of our work will not be short-term, would have had huge impact. On that note, I want to say that we have a support team. Stephanie is always available to support. You can call our chat with her. Now our tech team, IT, Dan is here, who is also always available to provide support. Then beyond that, we have a robust support system for the ViGit system. So each time you hear, if you have issues, all you need to do is to reach out to the calls that are there. And of course, you want to join the WhatsApp group, you also have the opportunity to join that. So on that, I want to thank you very much. These are our address. I can now take questions. And then if our guest speaker is now available, he can address us and we'll round up. Yeah. Okay. So any question? I'm back. Daniel, are you there? So we can take questions. If there are none, let me do the demo. Hello.
We can hear you.
Okay, so are there questions? Yes, Obaji, go ahead.
Thank you very much, Dr. Kenneth, for your presentation. I just want to get clarification on this the aspect you said from
Hello.
is it from June to July to join and be able to read myself to carry that we have registered or what?
What is it? I can't hear you. You can put in the chat box.
You don't get my question.
No, put in the chat box. We can't hear you. You are
No,
breaking.
are you hearing me now?
Yes, go ahead. Hello?
Hello, you are hearing me now?
Yes, go ahead.
Yes, I was asking the aspect where you say from June to July, you will be expecting the states that want to register 5 members.
Yes,
So I said in my own department, we are 4 plus myself 5. Can we say cross-party registered or what?
okay, fine. So what will happen is that once we are done with the 1 month information sharing, we can go state by state. So once you give us information, we simply document as part of the project process. So that is what will happen immediately after we are done with these Zoom meetings.
All right, thank you.
Because at the end of the October, we're going to send a questionnaire to each of the states. So you will now send out to these people that you are very sure they are part of the process to fill, so that we can have that analyzed.
Thank you very much, sir.
Yeah, any other question? I said Garba is in transit, so we need to give him time. If he gets to his destination, he can call us. So let's do the demo. Anybody who is new here can send his phone number and network to the chat box so that we can load your phone right from where we are using my wallet shop. Anybody? Anybody do that? If you are new on the call, Emelumadu, send your number. Hello. Bashir, you can send your number. Dr. Ango.
I thought my number is already there.
Okay, just send it with your chat box with your network now, so that I'll go on the screen and do that. So I'm going to sign up online. Yeah. So this is the platform. This is the portal. I've just gone online to look at the portal. This is how it looks like. So if you go online, most of the discussions that happen here are summarized on the platform. So look at the chart here. If you have a shop of 25,000, 1% is 250 naira. If you have 50,000, 1% is 500 naira. If you have 10,000, 1% is 1,000. If you have 250,000, 1% is 2,500 weekly. If you have 500,000, this 1% is 5,000 weekly. If you have 1 million, 1% is 10,000 weekly. Now, there are 52 weeks in a year. So if you estimate your expenditure of 50,000 per week, per month, in 12 months, you have 600,000. That money can never come back. So if you carry 600,000 and add 400,000 and create a shop of 1 million, by the following week, 7 days after, you get the first 10,000, and that will continue for 52 weeks. By the end of 52 weeks, you have 520,000, and your 1 million is still intact for you. That is what the telecom industry will give you, because it's trading the same way the bank does and offering commission on that money. So let me do a demo. I'll sign in now. Okay, is there any? Okay, let me see. Okay, this is MTN. Good. So I'm going to sign in now. I'm going to use, for this exercise, I'll use my personal wallet, my own wallet, not, so I'm signing in now. So I've come in. So most of you that know me, this is my name and it's my personal wallet. There's commission wallet here. In this commission wallet, there's 77,608. So the last two digits are 08. Now there's also airtime in voucher wallet of 7,700. I'm going to buy airtime of 500 each. 2% of 500 is actually 10 naira. So each time you see me buy airtime, 10 naira will be added to this. So I'm going to buy first for the first number that I saw. I'm going to go up here. Once you click on airtime, it gives you this, and you put the number there. Now, it's for all the networks. So this network is MTN. I'm putting 500. Once you click OK, the system takes you to where you can pick any of the wallets that has money. So if you come over here, these are various wallets: commission wallet, personal wallet, interest wallet, and a voucher wallet. So I have money in voucher wallet. I'm picking up here and saying pay. The system now automatically buy airtimes and send to the number anywhere the number is. Now in the next 30 seconds, that airtime should be on your phone. Now, once the airtime is on your phone, what has happened? It has deducted 500 naira from here. This was 7,700 naira. It has deducted 500 here. 2% of 500 is 10 naira. What was 0.80 has become 18. This is how this system works automatically. Let me go and pick. If I've seen the airtime, please show in the chat box that you have seen, so that we.
Yes, airtime received 500 naira.
Thank you very much. So I'm going to do this. This one I want to be biased. Intentionally, I'll be biased because it's my long-term friend. So I'm going to buy airtime using where is network? This one. I'm trying to. No, I want to buy the network. Okay, fine. Where is the network? Okay. The issue, I'm trying to get my network on the screen now. Yeah. Okay, so. The share screen. Okay, so I just did some delays, so it will go off. Can you see the chart?
Yes.
Okay, so I'm doing that now. I will buy airtime. The number now I have is from, I'm logging in now. I'm just logging again. I'm going to buy airtime. This time around, I'm going to buy 1,000 naira worth of airtime for my friend. And this is MTN number again. I simply come here, MTN, put 1,000. It will pick 1,000. And then from the platform, it will simply buy airtime from any of the shops. Remember that it can be your shop that this system is buying airtime from, but there's no way you would know. Obaji, I know that you have shops on the platform. It could be from your shop, it could be from anybody's platform. I just simply bought 1,000 naira worth of airtime. 2% of 1,000 naira is actually 20 naira. So it will simply add 20 naira to what was 18 to 38. And of course, I deducted 1,000. Now, if I've seen 1,000 naira on you, on the, please show us in the chat box. Commission. Huh? Yes, commission has been back to that. So thank you very much. This is how it works. We can take additional questions if there are any. Some of our members who.
Remaining one number, Dr. Kenneth, remaining one number.
Which number you own?
The first, my brother's number that he sent first.
Oh, your brother.
Yeah,
Okay,
he sent
so
first, and he didn't give him.
Where is his number now? Let him drop it. Okay, Raymond. Raymond, okay, thank you
Yes.
very much. So Raymond, I'm going to do airtime too for Raymond.
Ah.
Come here.
Okay.
So this is how it
That's a good
works.
one.
So Raymond, be watching out for your airtime.
Okay.
I put the same thing up. Oops, sorry. So your number is here.
070
I've seen it. I'll pick it up.
Okay.
So
Okay.
MTN, I'm going to put
Yes.
500 naira airtime. I do
Okay.
that. I simply move. Once I pick from any of the wallets, you can actually pick from any of the wallet. One where there's money, I just put from this one and say pay. Before you say 30 seconds, the funds is this. So what we created with ViGit is that one, we'll have Android phones that will simply have all the tools that we need installed on them. Two, we have advanced combo pack basic, linking all the people that we need to work with. And then three, we now have an automated ViGit trading system that makes this money and load the funds automatically. So you don't need to talk about 100,000 worth of airtime to run a system. Once you have put this into place, boom, everything is like automated at all times.
Yeah, it's here already.
If you have seen the airtime, let us know in the chat.
Yes,
seen
thank
it.
you.
I've
seen my airtime. Thank you, Kenneth.
All right, thank you, Ma. So this is what we are building. We've been on this for 18 months. We look forward to engaging us at state level, at association level to pilot this, and then we'll now showcase this at the next conference. So thank you very much, everybody. If there are no questions, we can close now. But if there are questions, Joshua is available to answer. I'm here. If you want to sign up, you can click the link. I'm sure our support team would have pasted the link. Yes, the link is somewhere there in the chat box. You can sign up. We'll have detailed discussion of whatever kind you want us to do.
Thank you, sir. I have a question concerning my shop wallet.
You said?
As I have a question concerning the shop wallet.
Okay, go ahead.
Yes, I think 3 Fridays ago, I upgraded to 50,000, and I wanted to, I thought it's just a kind of a gradual upgrade. I didn't know there are some, you upgrade to 50, move to 100, from 100 to 250. I thought that from 100, I will get to 150.
Okay,
so
no.
I did.
Okay, go ahead.
I wanted to move up to 250. I thought it's something you can do every day, but the last one I did, they said I cannot get it's still pending.
Okay, so you can't do it every day. Now let me explain to you what happens. The moment you engage a system, you are telling the system to have a 7-day trading cycle. So if today you activate an account on a particular amount of money, that amount will be used for this week trading. Remember that the money is converted to airtime and put in the pool like insurance. So all the monies that you put in the system, once you ask the system to move your money to wallet shop, it's no longer money. What is there is now airtime. So the system has a pool of airtime. It is only the portion that is accrued to you that you know it. So if you have 50,000, it means that 50,000 is in the system for 7 days. Until those 7 days finish. So on the eve of your weekly commission day, for instance, if you activate your account on Sunday, it means on Saturday, you can now upgrade to the next level so that by Sunday, it will pick up the new status. So if you did 50,000, I want to move to 100,000, you simply bring the difference. If from 50,000 you want to move to 250, you simply bring 200,000, I become 250. But if the system is trading within that week, it will not pick it up. So you simply move the money, and say, okay, fine. By the time it close trading for that week, it picks up the new cycle. Joshua may want to say a word, but that is how it works.
Okay, just to add up to what Dr. Kene has said, whatsoever happens here, it's a normal real life situations. What happened in day-to-day activity, that we are just automating it, that the system or the machine should do it for you now, the software should do it for you now, not the physical human being, not a manual way again. Take this scenario. You send Okechukwu to go to Lagos to go and buy goods for you. On his way, before he gets to Lagos, you call him that, okay, I send you with 50,000. I now brought another 100,000, another 50,000 for you. Okechukwu will say, okay, I've already gone to the market. So let me, on my coming back, once I bring this other ones, as I finish selling and I'm coming back with the profit, I will now pick this other additional stock you are giving me now. Okechukwu cannot start trading with this one you just brought and put in the warehouse now, including the one that is on the way going to Lagos with it. So once the system goes to the market, it has gone to the market with the old stock you instructed it to trade with. Remember, to you it's money, but to the system, it is airtime that is trading with. It has converted that. So until it comes back before it will pick this one, then to add up to what you were saying, that maybe you wanted to upgrade and they told you that you have a pending one. Simply, the system is simply saying, you had instructed me to upgrade. So I've not come back to pick this one. Hold on, let me come and pick this one. Immediately I pick this one, you can now do another upgrade. So for your case, the system will come by, immediately you see your commission, the system has picked the upgrade. So at that point you can upgrade. But if the system has not dropped your commission, meaning it's already trading with the previous amount, your present amount of upgrade has not been affected. But immediately you see your commission, just know that if you click to upgrade, it will now allow you to upgrade. Because once the commission drop, it simply means it has come back and it has picked this one and gone back again for another trading cycle. I don't know whether that is clear enough.
Very, very clear. Thank you very much, sir.
Thank you, sir.
Hello, may I ask if this if the recording can be shared?
Dr. Can I also ask, what's the referral ID? When you're trying to register, ask for referral ID number. Can you answer that, please? Can I muted though?
Yes, Zubair, I'm sending you a link. Just click on it now. Look at it in the chat box. The link for the project is in the chat box now.
It's asking of the referral ID.
Yes, it's built into it. Once you do that and you click on it, the referral ID is built into it.
Okay, another question was if the recording can be shared.
Yes, if it's not heavy enough, we'll share it. Why not? But we are hosting them on our website. So once we are done, we'll send you the link, you click, and then you can actually have access to them.
Thank you, sir.
Thank you.
All right, on that note, I want to thank you very much. We appreciate your time. We usually don't want to have more than an hour. We've done 90 minutes, 60 minutes. So thank you very much. Aku, thank you very much for joining us. Bashir, thank you very much. Raymond, thank you very much. Garba is in transit, is not available. Juliet, make a call now. So thank you very, very much, everyone. Look forward to